Thank you, Count Ceorla. I'm delighted to have the opportunity to speak about men's health today and describe some of the initiatives that my department and the HSE have in place to improve men's health. We are living longer as a society, and Ireland has one of the highest life expectancies in the EU, and this should be celebrated, but it also brings challenges. So we need to help people to enjoy good health and well-being at every stage of life and to try and close the life expectancy gap between men and women. The Healthy Ireland vision is one where everyone can enjoy physical and mental health and well-being to their full potential, and where well-being is valued at every level in society. Achieving this vision requires a whole of government and a whole of society approach, and my department supports a range of programmes and partnerships to improve men's health. The HSE have recently appointed a national programme manager to implement the Men's Health Action Plan. Alongside the voluntary sector, the HSE has led out on the development of a number of tailored programmes and campaigns on men's health. Engage, the National Men's Health Training Programme, provides health and community professionals with insights and skills on how to effectively engage men. This pioneering programme aims to improve the gender expertise of our health and social care workforce in relation to engaging men on their health. This training is delivered by the HSE Health Promotion and Improvement and coordinated by the Men's Development Network. Each year, the HSE provides funding for Men's Health Week, which aims to raise awareness of men's health issues through public campaigns and community events across Ireland. I want to acknowledge the invaluable work of the Irish Men's Sheds Association. My department, along with the Department of Rural and Community Development and the HSE, allocate funding to the association, who do such excellent work in our communities. Men's Sheds offer a supportive social environment for men, leading to reduced isolation, a stronger sense of community and improved health and well-being. There are over 450 sheds now established throughout the country. The sheds also deliver the Sheds for Life programme, and this involves health workshops, screenings and wellness activities over a 10-week period. Topics such as healthy eating, physical activity are covered, along with mental health and chronic disease prevention. The aim is to support men in more open and meaningful discussion around their physical and mental well-being. I also want to mention programmes such as the Moving On, which is a community-based physical activity programme delivered by the local sports partnership. It has been successful in reaching men who might not otherwise participate in exercising classes or other classes like within the physical, to give them that kind of a chance to I suppose. And I just, for someone that's learning all my own role, it's about, as other speakers have said, it's about communication, information, and letting men know what is there for them, letting them know what we have, and we have such good schemes and such good services there, and such other things that we can really help with. But the other one I want to talk about is the On Firm Ground. Another successful initiative is this, and this is a partnership programme between my department and the Department of Agriculture. So it trains agriculture advisors and veterinary staff to recognise signs of stress or mental health or ill health among farmers, and make referrals to your doctor and talk about it. And this is an excellent example of cross-government working, and I would like to acknowledge the leadership demonstrated by my colleagues in relation to improving farmer health and well-being. Another area that I'm very passionate about is reducing the gender gap in life expectancy and improving the health and well-being of men, means like driving programmes like the ones I outlined, and also encouraging greater participation in screening and health checks, absolutely vital. But I'm mindful that men account for over 70% of the cases treated for problem drug use last year, and as you know, drugs is within my remit. Men are also constantly in the majority of drug poisoning deaths every year since 2012, every year. While it is positive that men engage with drug services in large numbers, it is important that we focus on prevention and address the root causes of problematic drug use in men's lives at earlier stages. We must make health services more accessible to men and expand their models and encourage men to seek help. And that's one thing we are promoting. We need to say, seek help, it's there. I am committed to supporting the implementation of the Men's Health Action in the HSE, and I will be exploring the opportunities with Healthy Ireland for further cross-government work in 2026. I will be seeking to place a real focus on prevention and education in our upcoming national drug strategy, and I look forward to updating the House on this as the drafting progresses. And I want to thank everyone today. Thank you.
Minister.